Yeah, cannabis is a plant. Cannabis, the plant, has many types, many strains, and two main subtypes, I suppose. We look at indica and sativa. Um, Indica types of cannabis plant generally have more sleepy or somnolent effect, very good muscle relaxation, very good pain relief, and they're great for nighttime and for insomnia. Sativa is another general type of medication, a general type of cannabis, which tends to be more activating, not sleepy, but often energizing. Still good for pain relief, but often more mentally stimulating. So there's two broad types of cannabis medicine. When you're looking at chemovars or strains of cannabis medicine, so we're looking at things like Purple Kush or Blue Dream or any of the different names of cannabis you may have heard. These are different strains or chemovars of cannabis medicine. The difference between all of these plants is they have their own ratios of terpenes and flavonoids and THC, CBD, and minor cannabinoids. So, though one plant may be 22% THC and 5% CBD, there's a myriad of sub cannabinoids and other active ingredients in that plant that have its medicinal effects. So, that's why you have different strains of medication for different ailments. People generally find that certain types of medication are better for pain relief, certain types of medication are better for sleeping. So there's literally thousands and thousands and thousands of individual medicines which are constantly being crossbred by our breeders in around the world. And of course, there's the distinction between THC and CBD. Now, a lot of people think medicinal cannabis is just CBD. CBD is the second major cannabinoid. The main cannabinoid in cannabis is THC. But both of these molecules are found in the plant together always, maybe in varying quantities, largely varying quantities, but they're often always found together. So when people say medicinal cannabis is CBD, well, that's incorrect. Medicinal cannabis is all cannabis when used correctly and when grown correctly in a clean way. So I think that's an important distinction to make as well. Medicinal cannabis contains all components of the plant in varying ratios. So it can be very confusing. If you were trying to go to sleep and you took a sativa-based medication, then you're probably going to be woken up. So that'll be the wrong way to use that medication. So there is a lot of finesse and fine-tuning and individuality in cannabis medicines, and they're tailored to every individual. And I think that's the art of being a good cannabinoid clinician, being able to tailor those medicines and make those decisions for people because they just simply don't know.